Hi, everyone. My name is Carol Feldacker. Um, I presented a couple years ago. Anthony told me the last time I participated because typically this call overlaps with another routine call, actually using two-way texting in South Africa. So apologies for not typically attending the call, but I really love this community. I'm going to talk very briefly today about two-way texting for postoperative follow-up using the use case of South Africa, but we've also scaled up in Zimbabwe to about 45,000 men in care. So for those of you who don't know, and I'm going to guess there aren't a lot of voluntary medical male circumcision experts on the call, it's a voluntary procedure. It's an HIV prevention intervention. It's been adopted by the WHO and by PEPFAR and by UNAIDS as a very effective way of reducing a man's risk of acquiring HIV. Part of male circumcision is follow-up care to make sure that we can identify any man who has a potential complication early and make sure that they can heal well. In almost all countries that use VMMC, which I'm going to use for voluntary medical male circumcision, the ministries require men to come back 2, 7, and maybe even 14 days after their surgical procedure to make sure that they are healing well. But 99% of men heal well, so there is a real clear inefficiency in follow-up care. Back in 2018, we piloted and established the two-way texting methodology for follow-up, where instead of asking men to come back for routine in-person visits, we communicated them with SMS in a hybrid approach of automated messages, checking in, are you okay? And interactive messages, if they responded, no, I have a problem, then a circumcision nurse would interact with them by SMS. Since we demonstrated through a randomized control trial in Zimbabwe that two-way texting was safe, was more efficient, was more cost-effective, and was highly usable for clients and the nurses, we scaled up to South Africa. And in South Africa, again, we conducted another randomized control trial, building the same evidence. And now we are so excited to share that the software is available for you all. So again, just to repeat, voluntary medical male circumcision is safe. There are typically follow-up visits. Our two-way texting intervention aims to improve the efficiency of postoperative follow-up without any reduction in safety, which is the main driver of this intervention. And unlike many text interventions that really try to increase visits and try to promote that clients come back to care in a timely fashion, we're actually trying to prevent men who are healing well from coming in unnecessarily. So it's pretty interesting in terms of how this two-way texting engages clients, but not funneling most to care, trying to keep most safely at home and bringing only those who need nurse observation and support to come back to care. Otherwise, we're just improving communication. So I know that they don't use this word in South Africa, but we've been using it in Zimbabwe, calling two-way texting accessible telehealth. Telehealth is, in some countries, it's sort of like an appropriate, acceptable word, and just being very cautious of semantics and not using words that are inappropriate or have different implications in specific settings. I'm calling it this, but in South Africa, we definitely call it improved client to provider communication. We have a hard time sometimes convincing folks that two-way texting is innovative because they think, oh, what is it? It's just a simple SMS. But this direct-to-client communication and this two-way texting system is not just SMS. Not only did we develop, test, evaluate, and optimize in routine settings, making sure that it functioned well in low and middle income country settings, but we used human-centered design. It wasn't me or anyone from outside the Zimbabwean context coming in and saying, you will do this. But we took 2, almost 4 very painful and exciting and iterative years, making sure that two-way texting reflected the needs of the local nurses and the local healthcare providers. We did determine that it saved significant provider time. Again, we've demonstrated and established this using rigorous evidence. We're engaging male clients, so it's not just a send them a text in a one-off or a one-way communication, but it's really getting them to respond to us, to the nurses, and say, hey, I'm okay, or I have a problem. It improves data quality. And for those of us who sit on the healthcare services side and on the data use side and on the monitoring and evaluation side, this is critical. We know when our program is failing and we know when our program is succeeding. And we have the evidence trail from enrollment all the way through sunsetting each client out of the intervention. And again, we have rigorous evaluation data. So we actually know that we can say this works. It's not just mirrors and bells and whistles and sequence, but we have the data to demonstrate that this approach works. I hope that we have Calcile on the call. If you click on these links in the slides that will be shared, you can find the evidence from our Zimbabwe and South Africa study showing that it's safe, efficient, usable, saves costs, and that healthcare workers also like it. Calcile, are you able to unmute and just walk us through the screenshots? And apologies that we can't demo the for patient privacy concerns. We can't put you into our live site to share. And the demos, of course, need to be pre-populated, but we do have a series of videos that Evelyn will point to later. So let's show the next slide, and Calcile will just tell us what's happening when a healthcare provider might see this, what's happening. Thanks, Calcile.
Thank you. Hi, everyone. With this screen, this is where we say it's our messages channel or our messages tab. This is where the direct conversation between a nurse and a client takes place. The clients have got the liberty of sending a message at any point whereby they feel the need or any educational message from the nurses. They are able to respond to the messages. Also, the nurse is able to probe a message to a client if need be. If a client is said he has a problem before and then all of a sudden is quiet, then nurses are able to also check, how are you doing now since our last message? So it is a two-way conversation in that way that you can say what is wrong and the nurse can also come back to you and walk you through the healing or any educational message.
And in any language.
Yes, in any language of choice, because what happens when we are enrolling, they can choose their language, but when they are typing the messages, they can use any language they want to. You can mix different languages in one sentence as long as the message passes through to your nurse. Then we have a task management. In simple words, I always say it's a to-do list where you will find that the nurses or the user of the system is reminded that trace this client because this client hasn't been saying anything since our enrollment. Let's check up to this client. How is it doing? And then also say this is also where you can check referrals. There are clients that may have been messaging with chatting to the nurse, and then the nurse felt like this client is not doing well. Let's send you back to the clinic. This is where you will see those ones to say, come back, let's see how you're doing. And then also this is where we are able to see the minors. They have a different classification. Minors, those are our below 18s, where we feel they need close supervision, especially on their first days. Then the nurses can also be able to follow through. And we also have the dates. There is also due dates according to your list. If your list is a bit longer, you are able to go and check by list which one is the oldest and start working on that one.
Right, like for example, Calcile, we learned that a nurse in South Africa can handle about 500 clients a day, but sometimes people might get lost, right? So this task tab also lets them see, oh, let's not forget, this referral to care is still open. Or today, like Calcile said, this minor hasn't communicated with us. So thank goodness that this task sort of gives the nurse the reminders of what to do so that people don't get lost when you're managing so many clients at once. Sorry, Calcile, go ahead. Next.
You are right, Carol, because I would say, for example, here in South Africa, our program is seasonal. There are those days whereby clients, when we are enrolling, they are flocking in. There are quite a number. So this helps us to monitor, and it helps us to know that from that 40 that was enrolled 3 days ago, 10 of those haven't said anything. Check up on them, how they are doing. Okay, this is the People's tab. We also find it there in our taskbar, in our homepage. People's page, in simple language, I call it a file cabinet. This is where we keep our new enrollments. This is where we keep our old clients that were enrolled before. If you go into this shelf, it's more like physically retrieving a file of each and every client. We use this tab. First, we use this tab for enrollments. You can capture a new enrollment here, or you can search for one client who was already enrolled and probably you need some information. Then you are able to go into this one. You are also able to do a number of activities. For example, if you can see the right in the bottom of your screen on your right, it says confirm a clinic visit before in person. Those are other activities that you can, for example, if a client just popped into the clinic and then for review, not referred, not anything, they just felt like seeing a nurse, then this is where we capture that review. Rather than having a file with a split up information, paper form, and this system, we are able to keep everything under one shelf, which is the client's profile. If you go and search a client by name and type your 3 letters, search the client, then it pops up the whole profile from date of birth, from date of enrollment, when was the last activity done, was this client even responding well? Some of the clients you find that he will respond today and then the following day not. Or if they had sent a suspected AE, was it then resolved? If he was referred, was it resolved? If he was referred, what was the reason of that referral? There is quite a number of things that you can get from just a profile of a client from here. This is more like physically opening a file of that patient.
Oh, you were just talking about so many of these great things.
Yes. And then this one is the reports. This is where we keep tab of any activity that happens in the system. Be it there is for example, client one said no AE experienced. This is a client telling us that I'm fine today. I just woke up, I'm fine. Responding to the automated message that they've received. I'm okay, I don't need much today. But client 2 says, wait a minute, I think there is something, I need help. And then this is the very same client that we say to our nurses, go to the client quickly, check how can we help. Then the nurse is able to switch over to messages and message and have that chat with the client. And then client 3, remember I said we can capture in-person visits so that we keep it together in their file. This is also another activity that you can find there. There is nothing much that you do here, but it helps you to keep tabs of everything that is happening. New enrollments, you can see how many enrollments are coming in today. You can see client received SMS potential, the nurse, it means the hub nurse has referred someone. You are able as well to follow it up and say, was this client seen or what happened? All of these things, they are just activities that you see throughout the day.
Can you show the quick text on the next slide, please? Just so Kelsey can walk us through how easy it is for the clients.
Yes. Basically, these are the questions that our clients get. Daily, we call them their daily messages. These are checkups on them. Automated, early in the morning, you wake up after your circumcision day. Just when early in the morning, you are woken up by this message. How are you? Are you experiencing any bleeding, swelling, pus, pain, redness, wound opening? Yours to do is to send either a 0 if you feel fine, or if you feel like I need to talk to the nurse, whatever I'm experiencing now, I don't know what is it, or rather, let me just chat to a nurse. Is this normal? Then you send your one, then a pop-up message that will be asking you, what are the symptoms? More like, how can I help you? Then you are able as a client to type back and say, I think I'm bleeding. And then from there, it is then taken by the nurse to ask further questions, because we believe that our clients are uniquely different. They experience different things. So it's easier when the nurse, it's a live nurse, it's not a chatbot. In that way, they will be able to address every situation in a different way.
Oh, Kelsey, thank you so much. Let's not make any of these men uncomfortable. Although, just to remind you all, it's an excellent HIV prevention intervention. I thank you so much, Kelsey. That you're Kelsey has been with the team for 4 years now, and is an excellent resource for any of your future questions. Go ahead, Evelyn. You want to show at least where the videos are, and then we'll try to mop up Anthony within 3 minutes. Sound okay?
Yes, sounds good. Thanks, Carol and Kalsile. I think Kalsile has gone through the various processes from enrollment to follow-up of the clients, and more detailed videos on how this would look on the app are present in that link that goes to the illustrative videos. We have a playlist that goes from enrollment to navigating the different tasks and how client tracing and follow-up is done. I think Niraj will share that in the chat as well. Thanks.
Oh, I just wanted to give a quick glimmer into where we're moving next. And in the last few months of 2023, we piloted offering men not just the SMS, which we've been using mostly to promote equity because not everyone has access to smartphones or WhatsApp, but we wanted also to respond to clients that said, you know, can we use WhatsApp? Again, one of the main things that we like here is that clients do not download an app, right? Clients are just communicating with us via SMS. The nurse has to have a laptop or a tablet. In the clinic, they have to have a laptop or a tablet, but the men can just have your simple Nokia or Flip or Mbudzi phone or whatever it is. But some men had asked, and some of our collaborators had said, why aren't you using WhatsApp? So we gave it a try. The response rates between SMS and WhatsApp were the same from the men's perspective. Men liked having the option to choose, and we were trying to meet client preferences. But really, there were a lot of cons from the clinical side. WhatsApp does put in these artificial tech barriers in terms of the pace and level of interaction. For example, each day you can only send the clients one message, and if they don't respond, the nurse has to wait 24 hours before initiating a follow-up message. This can really constrain a nurse who has concerns about a client. There were issues with Meta individuals from WhatsApp having to approve our clinical messages, and that didn't really make any sense. Like, our clinicians created messages that had clinical content, and who was Meta to say that clinical content wasn't correct? So there were some complications there. And also, clients have to have data, or they have to have WhatsApp, and they have to have a smartphone. So we're not going to give them a smartphone or data or things like this. So there was a client cost that we couldn't cover. And ultimately, at this point, only 25% of clients chose WhatsApp. So although I think it's moving in the right direction, and we're glad that we were able to pilot this, at least from our perspective with this particular intervention, there is no race to make this or to replace the SMS-based two-way texting with WhatsApp. Even though we were in an urban setting with men, it didn't seem like we were tapping some unmet needs. So I think we can continue to progress and offer this opportunity to choose, but I don't think we need to drop SMS and switch approaches.
Yeah, Carol, as we are moving to the next slide, would you like to comment about if the SMS are free? That's a question from Priscilla.
Right, SMS are free, right? SMS are free for the clients, free to receive and free to send. They're all covered by the aggregator costs that the intervention itself covers, the program covers.
All right.
Oh, Craig has his hand up, but if it's a tech question, it's going to you, Evelyn.
No, Carol, it's a question to you. I appreciate the getting some data around that WhatsApp stuff, because we get that kind of thing in a lot of different contexts. I'm especially curious you mentioned those that chose to use it. Did they already have it, or did they choose to install it when they saw that it was an option?
I'm going to guess, although I don't know, and Calcile may know more, but I'm going to guess almost all of them had WhatsApp there. And that's in part because when they enroll in our program, they receive a confirmatory text so that we know it's the right man with the right phone, that we can actually say this communication channel is open. So we watch them enroll. So I'm going to guess the vast majority had it so that they just opened it up. We sent them the WhatsApp, you're enrolled, and it was available.
Okay.
Otherwise,
Gotcha.
I think they would just use WhatsApp, SMS, but I'm not sure. I would give myself high confidence, but not 100%.
Okay, thanks.
And also the men could change, right? Like it was a short code. So some men with WhatsApp appeared to have communicated some via SMS, and some men who enrolled with SMS may have asked a friend when they couldn't communicate to communicate back with us via WhatsApp. So it wasn't 100% you choose and you remain in your lane. The next slide, I just want to say that we have actually already started adapting to a texting for other postoperative or care engagement options. The next slide, I think, just says that we've started using it for retention support. So in Malawi, we use two-way texting to have a hybrid intervention of weekly motivational messages not related to HIV and specific antiretroviral therapy appointment reminders that come in 3 days before, and if you miss your visit, up to 11 days later to say, hey, please come back. And that mixed hybrid intervention has improved retention in visits by 10%, which may not sound like a lot, but when you are already, you have good retention, these are clients that are already like between 75 and 80% attendance, getting them up to 90 or 93% is a big deal, especially when it comes to reducing resistance to antiretroviral therapy. So this is really exciting. In this context, the healthcare workers also think that it reduces their workload or helps them do their work more efficiently, and that it appears to reduce program retention costs, especially at scale. Thanks.
All right. In an effort to share and further expand the reach of two-way texting, we've recently published the documentation on this on the CHT doc site, with the link provided up above, which Niraj will also share in the chat. So this documentation explores the hybrid system. It will take you through an overview of the solution, how we've adapted it for VMMC, but it will also give you a layout of the technical architecture of how the CHT is then linked and integrated with Rapid Pro, SMS aggregators, and mobile networks. And then it will go through the individual workflows and the user hierarchies and how we adapted this so that you can have an idea of how to fit it into a different context or the same context in a different geographical region. And then at the bottom there, you'll also find additional resources, including the open source code, training materials, including a user manual and the videos that we had shared earlier, and also all the related publications. In case of any further questions or communication, if it's on implementation general factors, you feel free to reach out to the people with the emails provided. In case of more technical questions, please feel free to add in a question on the CHT forum and doc site or reach out to Anthony and Niraj. Carol, any parting shots?
Yeah, why isn't your email up there for technical resources? No, just that this has been such a pleasure, and it's been a 4-year process. So this has been like well vetted, well established, and it's not, we have a lot of data behind to show that the approach works. And please reach out to us to help with your adaptations.
All right. Thanks, Carol, Evelyn, and Kansile for the great presentation. Any questions from community members? I think there is appreciation from some. Simon, I saw you, I think, sharing a comment. Would you like to unmute and share that?
Now, this reacting to how I think it's Kansime, how she's been able to personalize the system. How she names the tabs very differently from how we name them, just because it works for her. And I believe that it's become really a companion tool for her in provision of the service, which is amazing to see. And good job, and congrats, Karil, for going this far.
You've been with us for
Right.
years. Thanks, Simon.
Yeah, I can see a hand from Philip.
Yeah, thanks, Anthony, and good evening, good morning, everyone. I think mine is to pass a thumbs up to the team. I think, as Khalil says, it's been 4 years, and when we started all this, it was a very simple concept, but seeing how it has grown to impact so many lives just shows the potential that exists when we collaborate. So thumbs up to the team, and look forward to what's next in the next chapter.
Right. Thank you. So if any community member is interested to adopt two-way texting, please reach out to Karil, Evelyn, and Kansile, and they'll be able to provide guidance.